Welcome to Beyond Extraordinary, brought to you by LCMC Health. We are an 8-hospital system providing health, care, and education to the greater New Orleans area. We're a health system with 3 academic medical centers, and our academic medical center status means we have our finger on the pulse of the latest treatments and technologies in medicine, and we're bringing it right to our community. I'm your host, Kristen Gradney, Chief Wellness Officer. Today, we're joined by Andrea Patton, Senior Director of Women's Services across the LCMC Health System. Thank you so much for joining us today. We're so excited to have you here. May is Women's Health Month. So tell us more about yourself and what you do here at LCMC.
Sure. Thank you for having me. My name is Andrea Patton, and I'm the Senior Director of Women's Health for LCMC. My role focuses on improving maternal and infant outcomes, reducing disparities, and ensuring across the system that we're providing high quality, evidence-based care to all of our facilities. I oversee some programs, quality initiatives. I lead and support some community events and programs such as our Family Connects program, our Project M.O.M program, and just ultimately ensuring that every woman we serve receives safe and equitable care from LCMC.
That's a big job.
Yes.
That's a lot. And it is caring for such an important population in our community.
Yes.
We either all have a mother, we may be a mother, we know a mother. So this is really important work, not only to the mothers themselves, but so many others get impacted by this work.
Yes.
And so May is Women's Health Month, as I mentioned earlier, and it sounds like that should be a really important time for you and the work that you do. So tell us just a little bit more about Women's Health Month in general.
Yes, I love May. It's dedicated to raising awareness about the unique health needs of women, not just pregnant women, not just older women. We take care of women across the continuum of life from preconception to postpartum. And we focus on expressing how important it is to make women's health a priority during this month, not just this month, but all year round.
And, a lot of times we hear it's a priority and you should prioritize your health, and life is busy and there are so many things happening around us. And sometimes it's hard to even conceptualize, what does that mean? How do we prioritize our health?
Right. That's a great question. I get that a lot. People always say, what should I do? Well, it's about seeking care, not only seeking care when something is wrong, but seeking care that focuses on prevention. We want you to be healthy. That includes regular checkups, screenings, mammograms, pap smears, maintaining a healthy lifestyle, a diet. You know, things are different for women in their 20s, their 30s, their 40s, and there's different things that you should focus on. Um, Getting your pap smears annually, and checking up on your sexual health, making sure that you catch up on your HPV vaccinations and you're being screened for cervical cancer and breast cancer. And as you grow older and mature, our 65 plus women, you want to start adding in things like your vision and your hearing and different things that change, and to know your body and to be able to recognize when something is changing. So prioritizing your health is not just even going to the doctor to see what's going on with you physically. It's your mental health as well.
So as a woman, should we have multiple caregivers? Should we have a PCP and a gynecologist, or
Oh,
does that change?
absolutely. The care is getting more integrated now. That's the plan, so that you can be seen for something at your gynecologist, but your primary care has some input in that as well, and integrating that into behavioral health as well, so that you can be taken care of holistically.
Yeah, so really a team. So
Yes.
it's,
Yes.
as a woman, we should really have multiple
Yeah.
providers who help us in different areas
Absolutely.
so that we continue to prioritize that health, as you mentioned. So thinking about that, and you listed a lot of screenings and things for us to think about at different stages in life, but what are some of the biggest health concerns that women should be aware of, especially when it comes to cancer? We hear that a lot.
Yeah, breast cancer is the most significant one. It's the second most common cancer among women in the United States. 1 out of 8 women will be diagnosed.
Wow.
So it's important to know your body, recognize any changes, and stay consistent with screenings and annual exams. Another cancer that we have to be mindful of is cervical cancer. It's a big one, but it's often preventable. It's most often caused by HPV, and there is a vaccine for that. So the good news is routine pap smears and taking advantage of those vaccinations can help prevent that, and early detection can save your life. And then lastly, ovarian cancer. This one, unfortunately, is a little bit harder to detect. And we see it more in 55 plus women. That's why we still encourage you to have regular pelvic exams and pay attention to your body. That's the most important message that we can share.
Yeah, that's a big one. Pay attention to your body. And, we talked about all the different stages, and one major stage in a woman's life, especially if they choose to be a mother or can be a mother, is maternal health.
Yes.
So tell us some of the exciting things that we have going on here at LCMC Health to really help a woman navigate this time period in her life.
Okay, sure. We have 5 birthing hospitals. We have West Chef, East Chef, Turo, Lakeside, and Lakeview in Covington. So we cover patients both North Shore and South Shore. Our hospitals have been recognized nationally and locally for some of the designations. Recently, West Chef was recognized by U.S. News and World Report as one of the best maternity hospitals. And East Chef and Turo were both included on Newsweek's list of America's best maternity hospitals. We also have local designations awarded by Louisiana Department of Health, which is our birth ready designations, which we're very proud of. It's something that we have to rigorously submit data monthly and make sure that we're in compliance with all the stipulations that go along with these designations. And we're doing a lot to invest in women's services, particularly in our maternity areas. We're putting a $14 million renovation into Lakeside Hospital out in Metairie. There's going to be a consolidation of our Metairie hospitals, East Jeff and Lakeside, next year. And so we really want to turn that hospital into a destination place for women to seek care in that Metairie area. And to go along with that, you build up these beautiful birthing centers, and we also need NICUs if we have babies that require a higher level of care than what we can provide in the birthing hospitals. And over at Manning's Family Children's, we are in the process of building a beautiful 60-bed NICU that will support our birthing centers. So I can't wait, and we just pride ourselves in taking care of a variety of patients, making sure we have the resources that they need. I mentioned earlier about Family Connects. That's a program that we're in partnership with the New Orleans Department of Health. This is a phenomenal program where we have nurses that go to the homes and do a full head-to-toe assessment on mom and baby and their living situation. And they report back on resources and help them connect to anything that they need for themselves and their family. And the good news is we got some news from the state that that's going to be statewide. Right now it's only in Orleans Parish, so LCMC doesn't get to share it with all of our birthing hospitals, but it's a great opportunity for us to expand. So we have our hands in so much. And then I want to tell you a little bit about our Project M.O.M, which is our newest initiative. We're in partnership with the Louisiana Department of Health. Substance use and accidental overdose is the leading cause of associated pregnancy death in postpartum and pregnant women, probably since 2018. And so what the Louisiana Department of Health is doing is partnering with the hospitals that have obstetrical navigators in place. And they're going to employ some statewide substance use navigators to help connect these patients to treatment on the prenatal side and postpartum once they've been discharged from the hospitals. We pretty much have it covered while they're in-house, but there's a desperate need for some help on each side of that delivery. So I'm extremely proud of the work that we're doing. And, just we're working to make sure that we provide one level of care at all of our birthing facilities.
Such important work, and to hear that it's not just when you're in the hospital, when you're having the baby, or when you're at the doctor's appointment, but that there are resources to help you navigate those challenging moments, even if you go home and are unsure of what to do. And such a pivotal point in someone's life when they're having a baby. So to hear that there's a $14 million renovation and you can be in a beautiful space, and if your baby has to go to the NICU, then you know that there are resources there. So thank you for that work. That's so crucial and so important. And thinking a little bit more broadly, as we talked about, general wellness and health is a major priority. We should think of it as a priority in addition to all these other components of thinking about cancer and maternal health. But when we think about general wellness and specifically sexual and reproductive health, how does that fit into the overall well-being for a woman?
Well, it's a huge part of it. Like I said, our women's health service line focuses on from preconception um, to postpartum to postmenopausal, well beyond your reproductive years. We have programs where we go to high schools and we talk to students about sexually transmitted diseases and what they need to look for and how to practice safe sex because it's a reality. If we don't teach them,
That's right.
they won't know, and how to have regular GYN exams and connecting them with providers that specifically take care of them at whatever age spectrum they are, from our preteens to, like I said, our postmenopausal women. So taking care of that, and it's important, especially if they're planning to have a baby at some point in time, to make sure that all of their sexual health is in a good place before they do become pregnant and enter their reproductive ages.
Yeah, and it's so important to think that sexual health is a component of prioritizing your health because it is one of the components of our health that's lifelong or potentially, it doesn't just stop at a certain age. It doesn't necessarily change as we age. So to think about like, oh, wait, I really need to think about that. Even as a 46-year-old or a 66-year-old, it's always there and good to know that we have a resource. And another area, I think there are a few areas that as women, we think about but may not prioritize. So thinking about mental health, osteoporosis, lots of other areas that affect our total well-being. You know, tell us a little bit more about some of those and what should we be thinking about and what should we be doing?
Sure. Well, mental health is a hot topic, just in general. It's just as important as your physical health. Women experience anxiety and depression differently. And it's important to recognize changes in your mood and your energy and your sleep. We're so accustomed to being there for everybody, right? We take care of the family in most traditional families. And you often put yourself on the back burner, but prioritizing your own mental health it's a priority. You have to make it a priority because you can't give to someone and take care of and nurture if you yourself don't have the components that
That's
you
right.
need. So it's vital that women recognize when there is a difference in their mental health. And there's so many different things. Like you mentioned, osteoporosis. It affects millions of women. And this, we have to be careful with our women that are on birth control pills or Depo-Provera, the shot. It causes you to have um, issues with weak bones over time. So learning how to prevent those things by taking some calcium, taking some vitamin D, having those conversations with your physicians and just learning kind of what you need to do overall to take care of your health. And heart disease, right? It's actually the leading cause of death amongst women in the United States. And I will say LCMC is really focused on right now um, collaborating women's health with cardiovascular health to make sure that our women are being screened and referred properly so that they can get the help that they need. We live here in New Orleans. I always like to say it's a blessing and a curse. Our food is great, but it's killing us, right?
Yeah.
So, and we have diabetes, we have high blood pressure, and you need to take those things into consideration and exercise moderation to maintain a healthy lifestyle.
Yeah, absolutely. And to your point, like know your risk also so that you can be aware of what risk you step into it with and then how do you modify it. But you can't really do that if you're not
Right.
seeing your PCP or seeing your
Right.
OB on a regular basis. So that's why it's so important for women to prioritize their health and not just, in your home, but also make sure that you are keeping track of your appointments and the annual visits that we need to have. So we have talked about so much today. We've kind of gone the full gamut of a woman's health cycles and how do we prioritize health, and all vital information. So thinking about our listeners today and the women out there listening, let's recap and think about how does LCMC directly support them, or how can we directly support them?
Yes. Well, the message that we want to send is, LCMC wants everybody to know that we truly prioritize women's health. We have a full spectrum of everything that you need to take care of yourself. We have OBGYN providers. They offer a full range of services, like I said, from prenatal care to postpartum care to routine exams, screenings. We have 5 birthing hospitals with 27 affiliated clinics, where we can see you and answer any questions that you might have. Um, we've invested a lot into what we can offer to women. LCMC has the only level 4 birthing center in this state. That's huge. We received that designation from the Joint Commission last year at Turo. And so what we're doing with that is making sure that we can expand our services to hospitals that don't have the level of care that we're able to provide. We have the only #1 children's hospital in the Gulf South that we're extremely proud of, and we need that to go along with our birthing hospitals because moms and babies go together. Of course, children's does way more than, that, but we have obstetrical navigators that we've invested in for our birthing hospitals. And what that means is they really start working with the community and patients when they first find out they're pregnant, calling them, setting up appointments, prenatal visits, letting them know what our hospitals have to offer, and like literally navigating them through the process. Some of these women have no support system. So the connection with the navigator on the prenatal side is very helpful. And that might be the only face that they recognize when they come in to actually deliver. So our navigation program, we started that probably in 2023, and that has taken off. It's an awesome addition to what we have on the units. And I like to let everybody know about our little nursing nest. It's our little breastfeeding van that we take to all of the community events. And, it not only promotes breastfeeding, but it gives our moms a place to rest when you're at the French Quarter Fest or wherever you are and your baby needs to be changed and you need a few minutes of air conditioning and you need a breastfeeder pump.
Yeah.
So we just want to support women. And just let you know that LCMC has so much to offer. We have providers that's, like I said, specialize in the cardiovascular care, in menopause. Myself, I am beyond my reproductive years. So as we approach this menopausal thing, we need to know that there's doctors and providers that can take care of us.
It doesn't stop there. It continues.
We're having a baby. So every stage of life, and it's just, we just need to make sure that our message is women's health is a priority to us. We want you to schedule that appointment, start that healthy habit, check in with yourself, take care of your health. And once you take care of yourself, everything else just gets stronger.
Yeah. So I love that. And I hope that we've helped all the women listening today understand what it truly means to prioritize your health.
Yes.
And how important it is to us to help you be able to do that. And then how that impact just goes, beyond yourself, but the community and beyond. So thank you for all the work that you do in this space. And thank you for, making our community a healthier, happier place through moms and through women.
Yes.
And all those. And before you go, we have one question that we always ask our guests. So what do you do to keep yourself well?
Okay. Well, in my free time, I focus on simple things that keep me grounded. I spend time with my family. I stay active. I give myself permission to rest. I really do. In a role like mine, it's easy to stay in the go all the time. So I've learned that taking care of myself isn't optional. It's a priority.
Absolutely. You are practicing what you preach.
I am. It's necessary.
Well, thank you so much. Thank you for that.
Thank you.
And thank you for joining us today, Andrea, and thank you for listening. So join us as we go beyond extraordinary on the second Tuesday of every month.